So I think the biggest gap is the ability to take the strategy and implement it into actual provision of services. We have challenges around our estate and the level of investment that's been made into the buildings to provide the appropriate environments to treat people in. We're also challenged around staff and the workforce to deliver the care, and mindful that with gaps across the whole of the mental health pathway, people often escalate up through the pathway much quicker than they should really need to, and ending up in a more restrictive environment to receive their treatment. So to have a truly integrated mental health system, that is about everybody at every level being able to support individuals, to intervene as quickly as possible, and to offer the appropriate treatments in a timely way in an appropriate setting. And that isn't just about their mental health, it is about their physical health as well. So treating the individual holistically, taking on board their needs, their wishes and those of their carers, and really ensuring that every treatment plan is patient-centred and works towards delivering the right outcomes for those individuals. I think it's about being able to identify when people need help and support, offering it as quickly as possible, and where people are in distress and need to have an inpatient admission, that wherever possible it's as close to home as possible in the least restrictive environment, but also mindful that we do have some patients who will be in the more specialised services for longer periods of time, but again ensuring that that is provided against an evidence base, that it is patient-centred, and actually we are moving towards delivering outcomes and helping them to step back down through those levels of service and back out into the community as quickly as possible. It's having the right workforce who are trained and have the appropriate competencies and skills to care for the complexities of our patients, that we have environments that are geared towards delivering care, where we have the right lines of sight, modern buildings that enable people to move around as freely as possible within that, but within the safety parameters and keeping them safe while receiving treatment. And it's putting patients at the centre of our delivery of care, understanding their needs and how we can deliver an individual package of care using the right evidence-based treatments and working towards their goals and aspirations as well.